Good afternoon, everyone, and thank you for attending today's webinar, Managing Challenging Patients, presented by Arlene Liu with MedPro. Please be aware that there will be a question and answer portion throughout today's webinar. Please type your questions in the question box located on the right of your screen. We will be answering them as they are received during the webinar. Additionally, if you would like a copy of the presentation slides to keep or print out and take notes during the webinar, please find them on the right of your screen in the Handouts section. They will also be emailed to all participants following the completion of today's webinar, as well as a recorded version will be available on the website for members only. Again, we would like to thank you for attending, and I will now turn things over to Arlene.
Thank you. So we are talking about managing difficult and non-compliant patients. When I talk to medical practices, they often tell me that about 10% of their patient population is difficult to manage, but it could take up an exorbitant amount of time when it comes to dealing with these difficult situations. We'll skip through my bio, and I am, of course, your presenter today, and I work with MedPro Group. So the objective of the program is to help you to identify appropriate screening methods before you accept a patient that may be difficult for you to handle. We'll talk about factors that may contribute to problematic or non-compliant patient behaviors. We'll talk about patient factors, provider factors, and systems factors. We'll discuss techniques for managing difficult and non-compliant patients, and then also discuss, importantly, the process for discharging or terminating a patient from your practice. So let's talk about patient complaints. We know that patient complaints come from many sources. They can come in person, by phone, via email, of course, via the dreaded social media. Patients can also complain to their local state licensing board, to the insurance company. They can complain to the Office of Inspector General if they think that you've engaged in fraudulent billing, coding, or other forms of fraud, waste, and abuse. And of course, the Office of Civil Rights when you may have violated their privacy. So we know patients are getting more savvy about using the various sources and strategies for complaining about practice. So our goal is to really look at how do we proactively manage patient complaints so that they don't take it further and report you to the state licensing board or file a medical malpractice lawsuit against you. So essentially the complaint litigation cycle states that if a patient complains and we don't manage the situation appropriately or we avoid the situation, what can result is they can file a lawsuit, they can file a complaint, especially when we're talking about injuries or damage to injury, damage, or harm to the patient. So that's when we often see from a claims perspective where the lawsuits are being filed. And of course, it's also very stressful for practices and their staff and the providers when it comes to dealing with an active litigation. When we talk about difficult patients, you sort of have an idea of who these patients are, and not to stereotype patients, but it's important to realize, and recognize when a patient is potentially going to be difficult for you to manage, and to consider whether you want to go ahead and continue to care for the patient or even accept the patient in your practice. So patients that are difficult can often come in with unrealistic expectations, lots of demands. Sometimes they're the ones that are overutilizing the healthcare services, the resources, calling your practices frequently. Their behavior can and do escalate over time if we're not setting limits, if we're not managing some of the problems that come up. And then these patients are also likely to be more non-compliant with care. They're more likely to complain about the care. In addition, they're more likely to file lawsuits if there's any injuries involved as well. And compounding the problem is that patients can have factors that contribute to their difficult behavior, including complex medical histories. They may have diagnosed or undiagnosed psychiatric disorders. They may be coming in very ill and have other social and personal problems that, that they're not handling well, so they're taking it out on you and your staff. And of course, important to consider things like cultural factors that's impacting the ability of the patient to comply with the care and the recommendations. Look at language barriers and health literacy issues. And in addition to staff behavior, patient behavior, we have to consider our own behavior when it comes to managing difficult patient situations. Are we contributing to the problem? Do we come in exhausted, impatient, angry, or defensive? Do we respond defensively when a patient gets angry? Have we trained our staff appropriately? Are we dealing with, a staff that's inexperienced in communicating and handling difficult situations? Are we distracted in our care? Are we condescending or unprofessional in our demeanor? And then do we have personal biases that impact the care that we provide? So sometimes, again, our behavior can stimulate or trigger your patient's behavior as well, depending on how we react and manage these situations. In addition, there are system factors that can impact your patient's behavior and non-compliance. If you're chronically late and it takes 2 hours for the patient to see you, you have to recognize that they're going to be angry. If you have limited staffing, you're short on resources, you don't have appropriate support, there's significant time pressures. All these process issues can impact how a patient's going to react, whether they complain about the care. So it's always good to step back and think about what in your system is contributing to the problem and what can we do to improve that. And of course, staff training is always important when it comes to communicating and handling difficult patient situations. But more importantly, it's important to train our staff on treating patients well, being courteous, being professional. So next we're going to get into, before you accept the patients, there are opportunities to manage the situation and maybe even not accept the patient if you think they're going to be difficult or non-compliant. So let me pause for a minute to see if we might have any questions at this point.
At this time, there are no questions for you, Arlene.
Okay, great. Thank you. So look before you leave. What are some proactive steps to recognize these red flag patients? First, do they come in really happy to see you and they talk about the poor care they received everywhere else in the last provider's office, and they're just so happy that they found you? Do they have a history of doctor shopping, and is this something that you can find in records that you received from other providers? Do they have to travel a long distance to get to your office? Maybe they've been terminated at every other practice. Are they really savvy with social media and have a large social media presence? And then, of course, reviewing their records will help prepare you for any situations that you might encounter. So remember that just because you can help someone and take care of them does not mean that you have to, or you should. So you have the option of accepting or declining a patient in every situation. There's no law, rules, guidelines that say you must continue to treat a patient that you're having difficulty managing, or they're non-compliant, or they're just not getting along with you or your staff. But it's important to remember that if you're going to continue to work, and you should try to continue to work with some situations, you need to first make sure you're very clear up front about boundaries, limitations, expectations, and we'll talk more about some strategies for setting expectations and being clear about your expectations. And of course, you want to document well when you're dealing with a difficult patient situation. This information should be somewhere in the record. You also have the option of declining the patient by letting them know that you cannot meet their needs, and appropriately advising them of how to find another provider, confirming this with a letter, and we'll talk further about the termination and appropriate termination process as well. Okay, so always important to look at before you're getting into these difficult situations where you're handling a complicated, non-compliant, difficult patient. What can we do to be proactive to help decrease the incidence of difficult patients, to really manage our patients' expectations so that we provide good care and we receive less complaints? So as Bill Gates says, that we have to consider our most unhappy customers as our greatest source of learning and an opportunity for self-reflection and looking at what we can do to improve the care that we provide for our patients. So complaints are, in fact, an opportunity for us to look at the quality of care we provide, our policies, procedures, and processes that we have in place. Do we need to improve upon them? Looking at communication issues within the practice between providers, between staff and patients, between providers and patients. And we talk about this a lot in risk, but up to 70% of medical errors are a result of some kind of communications failure. So it tells us that we can really all do a better job of communicating with our patients, with other providers, and with our staff. And of course, again, a tool to look at what systems issues that you can improve upon in your practice, a tool to really look at how we train and work with our staff better in managing patient expectations. So here are some strategies to manage the patient relationship. First, consider the patient's health literacy level. Use tools and resources to manage the patient's expectations. If you're dealing with a difficult patient, consider using a behavior contract. And then in cases where your patient is absolutely refusing test procedures, consult, important to get some kind of signed sort of release called an informed refusal, and we'll go over that as well. So let's talk health literacy. And health literacy is defined as the ability of your patient to understand basic health information that you provide to them. And up to 50% of patients have low health literacy. And this is regardless of their age or socioeconomic status, their cultural background. It has more to do with, you talking to them in a foreign language. When you're using medical jargon and language, they're not going to understand the health condition well because we're sharing too much information with them. It's overwhelming. I'm sure you've all heard the statistics that, patients forget 80% of everything that you say to them when they leave your office. So we have to consider what we can do in terms of improving the way we communicate with our patients, because patients with low health literacy will be less likely to comply with your treatment. They may not seek preventative care. They're at double risk for hospitalizations, and then they usually need additional care that results in costs that are 4 times higher than those with higher literacy skills. So evaluate whether your patients need resources, and here are 2 tool and resource that you can use to improve patient compliance and health literacy level. Of course, everybody has heard of teach back. This is where you're asking the patient to teach back or demonstrate what you have just instructed them, because oftentimes they may be nodding their head but still have no idea how to do what you've told them to do. So remind your staff to teach the teach back method. And then the other strategy is the Ask Me 3 tool, which is available online for free. It's a tool that you give to your patient. It's a sheet of paper that explains 3 crucial questions to the patient. And actually, you give the patient the form to complete, and you're essentially asking them 3 questions that they complete, and they take the form home with them, and you want to keep a copy of the form in your file and record as evidence of, your education. But the goal is for you to, first of all, talk to your patient in layman's terms so that they understand what you're trying to teach them, and then focus them in on what is the primary reason for the visit, because often patients will have, a lot of things they want to talk to you about, but what is the primary reason they're here today? So help them to identify that and write that down in layman's terms. What is my main problem? What do I need to do about it? So specific, clear, simple instructions for that particular issue. And why is it important to do this? Because patients need to know why in order for them to comply. When it comes to cultural competency, I think we still need to do a better job of understanding that, we need to recognize there are cultural and language differences, and practices and beliefs. So it's important to really try to observe for misunderstanding, be patient when we're working with different cultures, respect language and cultural differences, and as required by law, use appropriate interpreters and language assistants as necessary. And you want to document that as well in your record when you are using an interpreter, an appropriate interpreter, that is. And another way to manage patient expectation is to set out expectations up front. You can do this in various ways, but one of the better ways to do this, or one way to do it anyways, is to have a good practice brochure where you're sort of welcoming the patient, but you're also laying out expectations that you want the patients to be aware of so that you don't surprise them later with a big bill or a termination letter. So this is a sample of one brochure on your lower right-hand corner there, but it provides things like logistical information, contact hours, who to contact after hours, your website information. It can have your mission and vision statement, biographies of your provider, maybe a personal letter from your provider, and then other expectations that you can have in the brochure includes your appointment, your cancellation policy, your fees for late no-show, so that, again, your patients are not surprised when you're charging them a fee. Any prescription refill guidelines, policies, your financial policy, your right to terminate the relationship. And then another good one to add is the mutual respect among all parties policy. So you're essentially telling patients that you expect that they will treat you with respect, you and your staff, and you will, of course, do the same for them. And here's an example of a mutual respect statement. The medical group X is committed to promoting an environment where mutual respect and open communication amongst the patient, staff, and the physicians are valued. And you can also identify in your brochure your patient's responsibility. Tell them they have a responsibility to speak up if they have a question, provide you with accurate medical history and updates as changes occur, to keep their appointments, to follow through with referrals and tests, and understanding that they have, self-pay obligations, and then that they actively engage with you in the treatment plan so that they are participating. So let me stop here really quick to see, do we have any question? We don't have any other at this point, but do you have any questions?
We actually had 2 questions come through. Okay. The first question is, can we legally not accept a patient that we know have these certain behaviors like doctor shopping?
Very good question. And you can, you don't have to accept a patient that you recognize as doing the doctor shopping thing, but you want to do it appropriately. So there are strategies for termination that's appropriate. So if someone comes in and you haven't had the first visit, it's recommended that you appropriately follow guidelines for termination at that point as well, in the form of, you know, writing a letter, letting them know that you're unable to accept them at this point. And we'll get into termination, but one of the key things with termination is that you do not have to give your patients a reason or 50 reasons why you're terminating them, because that can escalate the situation as well. So it's better to be professional and cordial in your tone when you're writing that termination letter.
Thank you. And the next question was, what is the name of the online form, referring to the slide Teach Back and Ask Me?
It's called the Ask Me 3 form. And, you know, I think I can send you all a link after if you're unable to find it. Usually I Google and there's free forms online. It's called the Ask Me 3 form because it was a form created by the AHRQ as a free tool for practices in the past, and I think it's still available free online. But if you have trouble finding it, let me know. All right, so let's move on with complaints as our opportunities. Again, complaints are opportunities to evaluate our practice, to improve the care we provide, to reduce the risk of errors. So from a risk management perspective, we really think it's a good thing for you to manage your complaint process and to manage it appropriately. So here's a quick checklist for you to look at whether you have a good complaint management process in place. Do you have a process for staff to handle complaints? And does that process involve, you know, letting you know anytime they recognize a potential problem? Does that process involve an identified individual who manages complaints that your staff know to go to anytime you have an issue? And then does it involve appropriately and quickly managing complaints as they come up and not letting them sit or escalate or waiting till a lawsuit or a complaint is filed with the medical board? And then as your process is in place, you'll be able to recognize, you know, how you can change or improve the care you're providing as you're going along. And it's always a good idea to trend and look at the patterns of complaints as well. So you can look at, well, you know, we've had a lot of complaints about, for instance, long wait times. What can we do to improve that? And another proactive strategy for managing patient expectation that we really like is the patient satisfaction survey. We know that a lot of insurance companies are requiring it now, and if they're not, we recommend that you initiate a process in your practice so you can, again, actively and proactively manage patient complaints and compliments. And this is an example of a really simple, easy tool so that it makes it easy for your patients to just check off and complete, because you want to encourage feedback about your practice. It is so much better if you're the one encouraging and you have a process in place internally for patients to voice their concerns and grievances rather than, you know, letting them go out to social media and complain about it. So again, a very simple tool for them to use, and you want to make it anonymous. You want to leave space for them to write comments as well. So how do we manage complaints? We should do it in a systematic way. We should have a process in place. So before you have to deal with a patient, be sure you're planning it out. You know, if you need to call your malpractice care, call your risk people, see if they can help you with appropriate communication and how to handle the process, and, you know, how to put a process in place for managing patient complaints. You want to practice before you meet with the patient and family what you're going to say, review the care you provided, anticipate questions, and know how you're going to handle some of these difficult questions. It's always okay to say, you know, I don't have the answer. I can come back to you. So it's not a one and done process. Handling complaint may take several conversations and meeting with the patient. So practice before you meet, demonstrate your understanding, always demonstrate sympathy, empathy. When the patient is communicating with you, you will want to avoid giving excuses for problems. You don't want to point fingers at your staff, at your providers. You want to under-promise but over-deliver in the care. And then listen so that you're verifying what their concerns are. Okay, if you want to give it one more last chance and you're not quite ready to terminate, because we really think that termination should be your last option when it comes to working with your patients, because if you can make a dissatisfied patient or patients happy, they tend to be more loyal and compliant after that. Behavior contracting is kind of something you go to as a last resort. And it's beneficial when working with patients who have patterns of maybe inappropriate behavior, communication style, manipulative behavior, continued noncompliance, financial barriers, drug seeking, or other addictive behavior. And here's a sample of the behavior contract between you and the patient. So essentially says, an effort to provide better care, the following expectations are required to maintain an effective provider-patient relationship. The agreement is between you and the patient, and then you lay out those expectations, the patient initials, and then you have them sign, and then you sign as a witness. And you want to make these customizable, you want to make it appropriate, you want to set a positive tone, so you can say statements such as, I will treat staff with respect and dignity, whether in the office or on the phone. I will contact the office in advance if I'm unable to keep my appointments. I will comply with my treatment plan and recommendations. Of course, you're not going to overwhelm your patients with an endless list of, their problems or what they must do. Stress that you're going to do your best to help them meet their needs as well, and you'll be working together with them. You want to list what you and your staff will do to help the patient and involve the patient in developing these expectations. Another good risk mitigation tool is the informed refusal form. And this form should be used when your patient is refusing a test, procedure, treatment, or consult. And it essentially shows that you've actually, sat down and talked to the patient about the risk benefits of not following through with your recommendation. And then it's a way to mitigate your risk if the patient later says, I was never advised of, the risk of foregoing this test or procedure or this consult the doctor recommended. So challenging patients, where do we start? First, it's important to, again, plan, prepare, step back, reflect, and understand that if you're angry, if you're resentful, if you're defensive, that it's a normal reaction, but you don't want to respond under these circumstances. So take a deep breath and a moment to collect your thoughts, plan before you meet with the patient. Oftentimes, if it's feasible, then you should plan a separate meeting where you invite the patient in to communicate about the problem rather than, do it at that moment. You want to sit down, really listen to the patient without interrupting unless absolutely necessary. It's always appropriate and very therapeutic to apologize for the situation. If the patient's complaining about, wait times or whatever, empathize with the patient. Say, I'm sorry you're going through this. I'm sorry you're upset. I see that it's very difficult for you. Respond as best as you can to their questions, concerns, with a positive attitude. Ask them, what can I do to help? Follow up if necessary if you're going to check on something or if you're unsure of a question that they've asked. Try to connect with the patient, address their underlying feelings. You sound worried, we're here to help, what can we do to help? Always strive to be respectful, to be professional, maintaining eye contact, sitting down, slowing down. And studies have shown that when you're communicating in a calm, collected, measured way, it tends to calm down a patient who's starting to escalate as well. So what do we avoid in these situations? We don't want to threaten our patients. We don't want to make assumptions about why they're angry. That's why it's important to listen, to ask them questions. You never want to distance yourself or avoid a difficult situation because, again, it just tends to get worse, or the patient finds other ways to complain about you. And you have probably heard this before, but oftentimes plaintiff lawyers will say that patients will go to them because they feel like the practice have not adequately addressed their concern, that they've tried to communicate with the practice. At the same time, we're not tolerating disruptive behavior. We're setting appropriate expectations, but we can't insist that the patient always follow our routine. And we should never take these situations personally either, and train our staff not to take it personally. If you're dealing with an angry patient, it's important to take them aside, maybe to a quiet room. You want to eliminate noise and distraction. Spend the time listening to them. You want to remain calm, in control, and collected at all times. Ask open-ended questions to gain clarity about what they're upset about, and paraphrase if necessary. You can increase their awareness of how their anger is affecting you, and you can say, Mr. Green, you may not realize that you're shouting at me. This makes me uncomfortable and prevents us from resolving your problem. Of course, set limits on appropriate and inappropriate expression of anger. You know, if they continue to escalate, if they're aggressive, tell them you may have to report it to security, to the police. And don't be afraid to do that if you are concerned for your safety or your staff safety. Okay, now if you're dealing with a violent patient, that's a little more scary, I know. And sometimes the causes are known and sometimes they're unknown. Your patients may have underlying psychiatric disorder, organic brain syndrome, drug, alcohol abuse, personality disorders. Some of the situation may be criminal in nature, and you want to handle and take all threats seriously. If there's any threat against you or staff, if you're concerned for your safety, get appropriate help. And that means calling the police, making a police report. Remember that violence and violent behaviors can occur very quickly, but usually there's some warning signs so that you can protect yourself. And then, of course, you know, everybody should have or understand a little something about active shooter training, because you want your staff to be prepared if someone walks in with a gun. I mean, that's not a fun topic to talk about. But if you look on YouTube, there's a really good video, very short, couple minutes long, called the Run, Hide, and Fight. It's called Run, Hide, and Fight. And this is 3 things that you and your staff should know to do if someone is coming in with a gun into your practice. So I recommend that video. It's developed by the Department of Justice, so it's a good video. For violent patients, and you know they're going to, you know, you see them escalating and becoming verbal, potentially physically abusive. Be sure you keep yourself safe, have another staff member present. Always stay at arm's length so that they're not able to reach out and grab you. That remain a relaxed posture. Be careful, make sure they don't, you know, have any kind of weapons that they could use against you. Think about having a code for your practice if someone becomes suddenly violent, that you could call out so that staff could call police or come in to help you. And train your staff to be careful. They don't want to be a hero in these situations because they could get hurt. The crisis development model is just one of those training programs that talks a lot, and it's a whole, you know, 2-day training program about managing escalating behavior and violence and communication. And the important takeaway from this training program is that, you know, again, usually there's some warning signs before someone becomes violent. So it's important to recognize if we can manage it early on. You know, our patients are going to show signs of anxiety, so we should be proactive, like we talked about, in terms of getting there early and being empathetic, being supportive, and communicating with them before the situation gets out of hand, before they become defensive. Again, still a manageable state, though, where they're just arguing with you, refusing and screaming at you. But at this point, you can still kind of work with them on limit setting, on slowing your tone and demeanor down, and de-escalating them. Because from there, it gets worse into risk behavior, where they are acting out aggressively and physically, and it becomes much more difficult to manage. So, strategies for challenging patients: always approach the problem with compassion and empathy, and recognize, like we talked about, you know, patients have a lot of things that's going on in their minds, and we may be contributing to the problem, so we always want to be compassionate, try to help them. We want to separate our emotions from the experience. They're not, you know, taking this out on you personally. So reframe the situation. Acknowledge the information from the patient's perspective, and get support if you need it on managing these situations. Don't forget to train your staff. So educate, train staff on hostile, aggressive behavior. Maybe conduct drills on managing difficult behavior. This is actually sort of a fun practice that you can engage your staff in. You know, pretend to be a belligerent patient and see how they handle it. So when you've tried everything and it's a dead end, what do you do now? This is where you can terminate the patient. Again, as a last resort, according to the AMA opinion, physicians, this is their ethical opinion, physicians do have an obligation to support continuity of care for their patients. They do have options of withdrawing care for the patient, but they cannot do so without giving proper notice to the patient and relatives as necessary, sufficiently long enough in advance so that the patient can find another provider if necessary. So that's the official AMA opinion and recommendation, which states that, yes, you can terminate a patient, but be sure you're following practice policies so that it's consistent across the practice, how your providers are managing the termination process, as well as it complies with any contractual obligations you have with the insurance company. You want to avoid allegations of abandonment, which is a common allegation if you don't appropriately terminate a patient. And so a lot of these situations, we recommend evaluating them individually. First of all, it's important to talk to the provider and clinician about the patient's care. Is the patient stable? Are they in some kind of phase treatment where they're not quite stable? Is it an obstetrical patient where we have to be more cautious about certain stages of their pregnancy where it would be riskier to terminate? And then for non-payment of bills, be cautious of timing. You don't want to terminate and demand money at the same time. I recommend using sort of a stage process to try to manage the collection of the bill before you officially terminate the patient. So what are the guidelines for termination? You want to be sure that the rationale is sort of generic and it's based on the long-term benefit to providing the patient of having a good provider-patient relationship. The letter should be business-like in tone and manner. It's non-confrontational. Again, you're not listing 50 reasons why you want to get rid of them. The reason for the actual discharge is not required, but you should offer emergency care or emergent care for at least a 30-day period. Provide them with appropriate resources for finding another healthcare provider. Help with any prescription refill requests during this time. Offer to send a copy of the medical record to their new provider, including the release form should be included. Indicate the need for follow-up as necessary for certain treatments that they still need to receive, or for treatments that they refuse to undergo that you recommended. You might want to list some of the risks if necessary of the treatment procedure. And then be careful that you don't schedule the patient for the next appointment inadvertently, or do anything else that gets them back on your provider patient list, because then you might have to go through the termination process all over again. It's practical and better to send the letter via certified mail. And then what happens if the patient terminates the relationship first and says, I'm not coming back to you? You still should send a confirming termination letter, certified with receipt requested, stating you're confirming the patient has decided to terminate the relationship. So, in summary, we should work on listening and trying to understand the patient's situation. We should look at improving our communication in the doctor-patient relationship when we're dealing with difficult patient and situation. Documentation of attempts to address noncompliance, to work with the patient, always looks good when we're trying to defend it from a medical malpractice standpoint. And then only terminate as a last resort after trying to work with them and appropriately documenting what you've done. Unless we're talking about threats involved, again, where you're concerned about your safety. And so I'm going to conclude with this statement from Maya Angelou because it's so appropriate for our program. Of course, you've all seen it. She says, I've learned that people will forget what you said, they will forget what you did, but they will never forget how you made them feel. And that could be good or bad. And so this concludes the program. Are there any questions?
So if anyone has any additional questions, you may type them in now. We do have one question, and it was, what was the site you recommended for active shooter training video?
Sorry, I didn't recommend an actual site, but it's on YouTube, and it's called the Run, Hide, Fight video. I believe it's 3 minutes in length, 3 to 5 minutes.
Thank you. And there was another question, just a reminder that the recording is available. It will be available on your state MGMA's website following this webinar. And I'll just give a couple more seconds if any other questions are going to come through. Okay, well, if there are no further questions, then we can wrap this up. Once again, the presentation slides will be emailed to all participants and will be available on our website, as well as a quick survey that we will send because your feedback is important. If you have any additional questions, please reach out to the presenter directly. Thank you, everyone, for attending, and thank you, Arlene, for a great presentation. I hope you all have a great day.
Thank you.